Before we begin today, I want to acknowledge something many of you have mentioned in the comments, that when you raise memory concerns with a doctor, the response is often a reassuring wave of the hand, that this is normal at your age, that a little forgetfulness is just part of getting older, that there is nothing to be done. And for many of you, that answer has felt dismissive, like the conversation was over before it started. Here is what those dismissals miss. A significant portion of memory decline in adults over 60 is not inevitable. It is driven by specific, identifiable, largely treatable causes. The 2024 Lancet Commission on Dementia Prevention, one of the most comprehensive reviews of the evidence ever published, concluded that roughly 45% of dementia cases may be preventable by addressing modifiable risk factors, factors that most seniors are never told about, factors that most people would never think to connect to their memory. Today, we are counting down 7 things that research suggests may be destroying memory and cognitive function after 60. Each one has a specific mechanism, a body of scientific evidence behind it, and a practical fix you can act on starting today. And when we reach number 1, you will discover the single factor with the largest population impact on dementia risk in the entire Lancet Commission, something experienced by roughly 2/3 of adults over 70, something almost universally dismissed as a minor inconvenience, and something that in a major randomized clinical trial was shown to slow cognitive decline in higher risk older adults by 48% simply by being treated. Before we begin, drop your age and where you are watching from in the comments. We read every single one. Now let us start with number 7. Number 7, physical inactivity. Number 7 is one that most people know matters for health, but almost nobody connects specifically to the memory center of the brain: physical inactivity. And the mechanism behind why it belongs on this list is one of the most striking findings in modern neuroscience. Deep in the brain sits a structure called the hippocampus. It is the region most directly responsible for forming new memories and consolidating experiences into long-term storage. It is also one of the first areas affected in Alzheimer's disease. And here is what most people are never told. The hippocampus is not a fixed structure. It shrinks with age, roughly 1 to 2% per year in sedentary older adults, and it can grow back with the right stimulus. A randomized controlled trial published in the Proceedings of the National Academy of Sciences followed 120 older adults over 1 year. Half were assigned to moderate aerobic exercise, half to stretching only. At the end of the year, the exercise group had grown their hippocampus by approximately 2%. The stretching group had lost about 1.4%, and the memory scores of the exercise group improved measurably. The researchers noted this was equivalent to reversing 1 to 2 years of age-related brain shrinkage with a walking program. The mechanism is a protein called brain-derived neurotrophic factor. Exercise increases its production, and it acts like fertilizer for brain cells, supporting new neuron growth and the connections between them. The hippocampus is one of the few regions of the adult brain where new neurons can still form. What you can do right now. The trial used moderate intensity walking 3 times per week, 30 to 40 minutes per session. Brisk enough to raise your breathing, but still comfortable enough to hold a conversation. You do not need a gym. You need a consistent schedule and a pair of shoes. Start with what you can manage and build gradually. If walking is uncomfortable due to joint pain, water-based movement produces similar cardiovascular and cognitive benefits. The key variable is sustained elevation of the heart rate, not the specific activity used to achieve it. Number 6, untreated depression. Number 6, surprises many people because depression is not typically thought of as a memory condition. But in older adults, it can do something that almost no other condition mimics so completely. It can look exactly like dementia. Researchers have a name for this: pseudodementia. When an older adult develops depression, the cognitive symptoms that accompany it, significant memory impairment, difficulty concentrating, slowed thinking, and social withdrawal, can be so pronounced that even experienced clinicians initially mistake them for early Alzheimer's disease. When the depression is treated, those cognitive symptoms frequently resolve. There's also a deeper biological mechanism. Chronic stress and the hormone it produces, cortisol, cause measurable physical damage to the hippocampus over time. The glucocorticoid hypothesis, supported by decades of research, holds that sustained high cortisol gradually degrades memory-critical brain structures. And critically, when the chronic stress resolves and cortisol levels fall, studies have found that hippocampal volume can increase again and memory scores improve. The brain is more resilient than most people are told. The 2024 Lancet Commission identified depression as carrying a 3% population attributable fraction for dementia, with people who experienced depression 10 to 14 years prior having more than double the dementia risk of those who did not. What you can do right now. The first step is to stop attributing persistent low mood, apathy, withdrawal, and cognitive slowness entirely to aging. These symptoms deserve a real conversation with a doctor rather than acceptance. Depression in older adults is highly treatable. Clinical remission occurs in the majority of older adults after appropriate treatment through medication, psychotherapy, or both. And once the depression resolves, the cognitive fog that accompanied it frequently lifts. Bring specific examples to the appointment. When did the changes start? What was happening in your life around that time? These details help a clinician distinguish depression-driven cognitive change from other causes. If you are finding this video helpful, please take a moment to like it, subscribe, and hit the notification bell so you never miss what we create for you. Number 5 is a risk factor whose evidence has grown dramatically in recent years. Number 5, social isolation and loneliness. Number 5 is one where the research has become increasingly difficult to ignore: social isolation and loneliness. The 2024 Lancet Commission placed social isolation at a 5% population attributable fraction for dementia, making it one of the most significant late-life risk factors they identify. Here is the mechanism. Social engagement is cognitively demanding in a protective way. A real conversation requires you to recall names and shared history, track multiple threads simultaneously, read emotional cues, and formulate responses in real time. It is a continuous workout for memory and executive function. When that stimulus disappears through retirement, bereavement, or hearing loss, the cognitive workout stops. At the same time, isolation is associated with elevated inflammation and chronically higher cortisol, both independently damaging to the aging brain. And the subjective experience of loneliness, which is distinct from the objective fact of being alone, carries its own independent risk. A meta-analysis published in Nature Mental Health in 2024, pooling 21 longitudinal studies involving over 600,000 individuals, found that feeling lonely raised dementia risk by 31%. The effect was consistent across countries, age groups, and study designs. The Alzheimer's Association has identified social isolation as a modifiable risk factor deserving urgent attention. What you can do right now. The goal is not simply to be around people. It is to be genuinely engaged with them in a cognitively demanding way. Passive social exposure does not produce the same brain benefit as active, interactive conversation. Schedule at least one structured, cognitively engaging social activity each week. A card game, a book club, a class, a volunteer role, or a regular conversation with someone who makes you think and challenges your perspective. Consistency matters more than the format. And if hearing loss has been making social situations exhausting or embarrassing, treating it, as we will discuss at number 1, is often the prerequisite that makes genuine re-engagement possible. Number 4, medications that are quietly affecting your memory. Number 4 is one of the most immediately actionable entries on this list, because the problem is not a disease or an aging process. In many cases, it is a pill. One that has been in the medicine cabinet for years, prescribed for a completely different reason, with nobody connecting it to the memory changes that have been gradually accumulating. There's a class of medications called anticholinergics. They work by blocking a neurotransmitter called acetylcholine, which is central to memory, learning, and attention. Common examples include certain over-the-counter antihistamines, some bladder medications, older antidepressants, and various sleep aids. In a younger brain with abundant acetylcholine reserves, brief exposure causes temporary impairment that clears quickly. But in an aging brain that already has reduced cholinergic capacity, sustained exposure is a very different matter. A landmark study published in JAMA Internal Medicine followed over 3,400 adults aged 65 and older for a mean of 7 years. Those with the highest cumulative exposure to strong anticholinergic medications had a 54% higher risk of developing dementia and a 63% higher risk of Alzheimer's disease, with a significant dose-response relationship. The researchers noted the risk may persist even after discontinuation. I recall a woman named Patricia in her early 70s who had been assessed by 2 doctors for possible early dementia. Her memory for recent events had declined noticeably over 18 months. When her daughter insisted on a full medication review, the pharmacist identified that Patricia had been taking a bladder medication with strong anticholinergic properties for nearly 3 years, prescribed by a specialist who had not been informed of her other prescriptions. When it was switched to a lower-risk alternative under medical supervision, Patricia's family noticed clear improvement in her cognitive clarity within 6 weeks. She said she felt like herself again. What you can do right now: write down every medication and supplement you take, including over-the-counter sleep aids and antihistamines. Book a medication review with your pharmacist and ask specifically about anticholinergic burden. Ask whether safer alternatives exist for anything flagged. Common lower-risk swaps include loratadine instead of diphenhydramine for allergies and mirabegeron instead of oxybutynin for bladder control. Never stop any prescription medication without first discussing it with your doctor. Number 3, uncontrolled blood pressure and blood sugar. Number 3 is a risk factor every senior has been told about for the heart. But the brain connection is far less discussed, far more serious, and far less understood by the people most affected. Here is what sustained high blood pressure does to the brain. The small blood vessels that supply the brain's white matter are highly sensitive to pressure damage. When blood pressure remains elevated over months and years, those vessels thicken, narrow, and sometimes rupture in tiny, silent events. The result is accumulated damage that disrupts the connections between brain regions and slows the communication networks that memory and thinking depend on. The damage is quiet, cumulative, and invisible. And by the time memory changes are noticeable, years of harm have already occurred. A study following over 4,700 adults across 25 years found that people with hypertension in both midlife and late life were 49% more likely to develop dementia than those who maintained consistently normal blood pressure throughout. Uncontrolled blood sugar tells a parallel story. Chronic high glucose damages the same small cerebral vessels, impairs the brain's own insulin signaling pathways, and shrinks the hippocampus. Older adults with type 2 diabetes experience cognitive decline at roughly double the rate of those without it. What you can do right now: know your numbers and ask your doctor what target is optimal specifically for brain protection. If you have not had your blood pressure or blood sugar checked in the past 6 months, make that appointment. Ask whether your current treatment is achieving those targets, not just whether your readings fall within an acceptable range. The 2024 Lancet Commission also added LDL cholesterol as a significant new modifiable factor with a 7% population attributable fraction, making lipid control another important conversation worth having explicitly at your next appointment. The brain benefits of tight vascular risk control are real, evidence-backed, and available to almost everyone. Number 2, chronic poor sleep and untreated sleep apnea. Number 2 is a mechanism that fundamentally changed how scientists think about what sleep is actually for, and it has a direct connection to the proteins associated with Alzheimer's disease. During deep, slow-wave sleep, the brain activates a waste clearance network called the glymphatic system. Channels open between brain cells, cerebrospinal fluid flows through, and metabolic waste products, including amyloid beta, the protein that accumulates in the brains of people with Alzheimer's disease, are flushed out. Amyloid is produced during wakefulness and cleared during sleep. When sleep is chronically insufficient or fragmented, the balance tips toward accumulation, night after night, year after year. Obstructive sleep apnea adds another layer. Each episode of airway collapse drops oxygen levels in the blood, triggers a sympathetic nervous system surge, and directly disrupts the lymphatic clearance process. A recent Mayo Clinic study of nearly 3,000 cognitively healthy older adults found that those with chronic insomnia were 40% more likely to develop dementia or mild cognitive impairment, with brain imaging showing greater amyloid accumulation compared to those who slept well. What you can do right now. Ask yourself honestly whether you consistently wake feeling genuinely rested. If the answer is no, and especially if you snore, wake unrefreshed, or have been told you stop breathing during sleep, request a sleep evaluation. Home sleep studies are now widely available and do not require spending a night in a clinic. If sleep apnea is diagnosed, CPAP therapy keeps the airway open and restores deep sleep. It has been reported to reverse dementia-like symptoms in some patients. The nightly clearance of amyloid can resume once the airway is protected. Keep a consistent wake time every day. Limit alcohol in the evening, which suppresses deep sleep even in modest amounts. Keep the bedroom cool and dark. These are not vague lifestyle suggestions. They are direct interventions in the nightly biological process that removes the proteins most associated with memory loss. Now, let us reach number 1. The factor with the largest single estimated impact on dementia risk, and the one a major clinical trial showed can slow cognitive decline by nearly half. Number 1, untreated hearing loss. After 6 entries spanning exercise, mood, social connection, medications, vascular health, and sleep, number 1 is the one most likely to surprise. Not because it is rare, but because the connection between it and memory loss is so consistently overlooked, and the evidence for treating it is so strong that it earns every bit of the top position. Untreated hearing loss. Here is the scale first. Research using objective audiometry testing found that roughly 68% of adults over 70 have some degree of hearing loss. 2 in 3 people in this age group, and most of them think of it as a minor inconvenience rather than a brain risk. Here is the mechanism. When hearing loss is untreated, the brain must divert significant cognitive resources toward decoding a degraded sound signal. Processing impaired speech demands more working memory, more attention, and more mental effort than processing clear speech. This continuous diversion comes at a direct cost to the memory and thinking functions that should be available for other tasks. Over years and decades, it also contributes to faster brain atrophy in auditory and memory processing regions. At the same time, the social withdrawal that so often accompanies untreated hearing loss removes the cognitive stimulation that conversation provides, compounding the damage from 2 directions simultaneously. The 2024 Lancet Commission placed hearing loss at a 7% population attributable fraction. That is the largest single modifiable factor they identify. 7% of all dementia cases may be attributable to untreated hearing loss alone. And then there is the trial. The ACHIEVE trial was a major randomized clinical trial funded by the NIH, following nearly 1,000 adults aged 70 to 84. Among participants at higher cognitive risk, those who received professional hearing support showed cognitive decline that was 48% slower over 3 years compared to those who received only general wellness support. A subsequent analysis found 62% slower decline in the highest risk group. In a field where most interventions produce modest effects at best, these numbers are remarkable. What you can do right now, if you've been avoiding a hearing test, or if you have results showing some loss that you've not acted on, this is the conversation to prioritize above almost anything else on this list. Ask your primary care doctor for a referral to an audiologist for a formal hearing assessment. Over-the-counter hearing aids became available in the United States in 2022, significantly reducing the cost barrier that kept many seniors from accessing treatment. If you are outside the United States, speak to your doctor or audiologist about the most accessible options in your country. If you already have hearing aids, wear them consistently every day. Not just for important occasions, the cognitive benefit comes from daily, sustained correction of the sound signal. The brain needs consistent, clear, auditory input to maintain the processing circuits that protect against decline. And if you have been thinking of your hearing loss as too minor to prioritize, consider this. Of everything on today's list, treating hearing loss may be the single most powerful action an older adult can take for their long-term brain health. A large randomized trial supported that conclusion. That is a rare thing in the science of dementia prevention, and it is available right now. Here is what today's countdown tells us. Memory decline after 60 is not a single story with a single ending already written. It is a set of risk factors, most of them modifiable, most of them overlooked, and most of them carrying practical responses that require no specialist and no prescription to begin. 7 things that research suggests may be destroying memory after 60. 7 practical responses. Physical inactivity shrinks the hippocampus at a rate that a moderate walking program has been shown in a randomized trial to reverse. Untreated depression produces cognitive symptoms that clear when the depression is treated and carries long-term brain risk when left alone. Social isolation removes the cognitive workout that genuine human connection provides, and loneliness raises dementia risk by nearly 1/3 in the largest analysis ever conducted. Certain common medications, including over-the-counter sleep aids and antihistamines, carry a substantially higher dementia risk at high cumulative doses, and safer alternatives exist for most of them. Uncontrolled blood pressure and blood sugar damage the small vessels that supply the brain's memory networks silently and over years, and controlling them is one of the most powerful protective steps available. Chronic poor sleep and untreated sleep apnea disrupt the nightly clearance of the proteins associated with Alzheimer's disease. And hearing loss, experienced by 2 in 3 adults over 70, is the single largest modifiable contributor to dementia risk, identified in the most comprehensive prevention review ever published, with trial data showing treatment can slow cognitive decline by nearly half. The 2024 Lancet Commission concluded that roughly 45% of dementia may be preventable. That number represents a genuine possibility that most people have never been offered as a way of thinking about what is happening to their memory. Which of these 7 do you think is most relevant to you? Leave it in the comments. We read every single one. If you found this video helpful, please like, subscribe, and hit the notification bell so you never miss the next one. And share this with someone you love who's over 60 and worried about their memory. The information in this video might be exactly what changes the conversation they are having with their doctor. Thank you for watching, and we will see you in the next video.